For more than 2 decades, Professor Rayaz Malik has been developing a groundbreaking eye imaging technique capable of detecting a range of neurodegenerative diseases. Known as corneal confocal microscopy, the method can identify conditions such as Parkinson's disease, multiple sclerosis and dementia years before symptoms appear. Well, Professor Malik explains how the technology works.
I'm Professor Rayaz Malik. I am Professor of Medicine in Weill Cornell Medicine-Qatar here and consultant physician in Hamad. I have been, for the last 25 years, developing this technique of CCM, which is corneal confocal microscopy. What is that? Well, it's a simple eye scan. A scan of your eye in 2 to 3 minutes, and I can tell you whether or not A, you have a particular neurodegenerative disease. What's a neurodegenerative disease? Dementia, Parkinson's disease, multiple sclerosis, damage due to diabetes. And I can also predict those people who are at risk of developing these diseases. So, Fatima, this is, as you can see, easy. You just had a scan and you can see we have images of your nerve fibres. So what you see here are images of the nerve fibres. Just like an MRI scan, you see images of the brain. Here you're seeing images of individual nerves. So after we have the image, the AI algorithm is designed to look at that image, recognize the nerve features, and actually within seconds will tell me how many nerves there are, how many branches there are in disease and in health. So this is corneal confocal microscopy in a nutshell. The eye, the cornea, the scan that you've seen, detects neurodegeneration in peripheral nerves in the brain. AI looks at those and identifies different diseases. So what do I see as the future? People will go have a scan. AI will look at that scan, tell me where there's damage that you can see here compared to healthy. If you're healthy, go away. If you're not healthy, AI will then again look at those same nerve fibers and tell me whether you've got dementia, diabetic neuropathy, or even autism. So far, we've done studies in diabetes, and we can say at least 5 years before they develop what we call diabetic neuropathy, they have it. Dementia, we've also done it in Qatar at least 3 years before. And that's the big holy grail that we currently, the way we deal with these neurodegenerative diseases is that we diagnose them and it's too late. You know, what you need is advanced warning so you can do something about it. How do I relate this to what's in this part of the world? Nur al-Ain. What is that? Well, the light of the eye. And I believe we have shone a light on the eye for neurodegenerative diseases.